Hey guys, what's up? Welcome back to Staying Strong for Marriage. It's great to have you as always. We're going to be looking at another COVID video after the Tim Pool COVID experience, all the hassles that he went through. My big takeaway from that, and I'm trying to take my own advice, is to have a plan, come up with a plan, know what I'm going to be doing. So, since I made that video, I did call a local doctor who does do the Regeneron treatment. It's going to take 3 weeks to get in as a new patient, so I'm going to do some research while I'm waiting to, get in with the doctor. And I'm not even sure I'm going to be taking this. But hey, I want to put something together for my family as well so that they would have some nice, easy to understand information. And I want to share the same thing with you. As you can see here, regen-cov is what they call it, often just called Regeneron, Casirivimab, and Imdevimab. And this is as of September 2021, so very recent. And the thing to know about it is it's limited. Basically, it's not available, not authorized for patients. So this is one of the cool things they found out doing some of these trials in the last year that we now know. So it's not good for people who are hospitalized due to COVID, or it's not good for people who require oxygen therapy due to COVID, or who require increased baseline oxygen flow rate. Okay, so this is not for them. That's what they found out. Basically, this is not for them. So who is it for? Post-exposure prophylaxis, so meaning this is like a preventative. So say I went out and I was exposed to someone who maybe tested positive yesterday, and I want to have some preventative, right? Some before it gets going on me, I want to use it as, that's what prophylaxis means. Prophylactic means a prevention. Okay, so you can get this if you want. It's available for people who are not fully vaccinated. Okay, so not fully vaccinated. And of course, that's a super loaded term, right? A lot of people maybe have one but not both, or they had both, but it hasn't been 2 weeks since they had both, or whatever it means now with a third or a booster or whatever that means, or waning immunity or whatever. I don't know. Who knows? That's going to be an evolving term. Or who are not expected to mount an adequate immune response to complete SARS-CoV-2 vaccination. What else do they say? And have been exposed to an individual infected with SARS-CoV-2 consistent with close contact criteria per the CDC, or who are at high risk exposure of occurrence of SARS-CoV-2 with other individuals in the same institutional setting, for example, nursing home, prison, say maybe hospital, school, who knows, whatever. And this is the one that we're probably most interested in here that I skipped over, the treatment. So regen-cov is authorized for treatment of mild to moderate coronavirus disease, 2019, COVID-19 in adults and pediatric patients. You got to be 12 years of age and older and weighing at least 40 kilograms. So there's 2.2 pounds in a kilogram. So what we're talking about, 88 pounds with positive test results of direct SARS-CoV-2 viral testing, and who are at high risk for progression to severe COVID-19, including hospitalization or death. So, okay, like I said, you got to call, you got to find someone in your area that a network of doctors that are running this. All right, so here's one of the things that came out from Regeneron's Investor in Media. It came out September 29th, 2020, so this is a long time ago. But Regeneron's Regen-cov antibody cocktail reduces viral levels and improves symptoms in non-hospitalized COVID-19 patients. So they're talk about it. And this is back in the day when they didn't know what the right dose was. They were running 8 grams, 2.4 grams. The article that it came from the New England Journal of Medicine, and Dr. Christy Risinger, she references this. But in the full analysis set, so 6% of people in the placebo group and 3% in the combined Regeneron-CoV-2 group had a medically attended event. So that's basically how, in this study, they decided if it worked or not, basically. Did someone need to go to the hospital, or did someone need to go to a doctor? Table 3, serious adverse events and adverse events with special interest in the safety population. Okay, so this is important. And you got to realize one thing, that these are like older studies, so they're running these really high doses. 2.4 grams, 8 grams. What we're going to get now is 0.6 grams. So we're not even going to get a whole gram of each of these, okay? They're running these really high doses back at this point. There's 176 people in the treatment group. There's 93 people in the placebo group. Let's just go through it. Any serious adverse events, the numbers in the parentheses are the percentages. So that's the best way to look at it. So we want to compare percents to percents. That takes out this distortion from there being a lot of people in the treatment group and a low number of people in the placebo. So any serious adverse events, yes, 1% in the treatment group, 2% in placebo. Any adverse events of special interest? What does that mean? There's a little star. Events were grade 2 or higher hypersensitivity reactions or infusion-related reactions. So grade 2 or higher. That would be a special interest, and 1% in treatment, 2% in placebo. Any serious adverse events of special interest. So this was any adverse events, and this is serious adverse events. On this one, 0 and 0. So that's good. Grade 2, greater or equal to infusion-related reactions within 4 days. So infusion reactions, this is important because we're going to see later that there's a lot less bad stuff happening if you got the infusion versus the injection. That's what we'll see. But this is infusion. There's 1% in the treatment group, 1% in placebo. What about grade 2 hypersensitivity reaction within 29 days? So this one was in 4 days. This was within 29 days. 1% within 29 days. 2% placebo. Well, that's interesting, right? Because this is no drug. They're just getting placebo. So it seems like it maybe has something more to do with I hate to guess, maybe something to do with the dilutive liquids that they use causing that. I don't know. I mean, these people didn't get the monoclonal antibodies, and they had 2% grade 2 or greater hypersensitivity reaction within 29 days. Adverse events that occurred or worsening during the observation period had 1% and 1%. Events that led to death, 0 and 0, that's good. Events that led to withdrawal from the trial, 0 and 0. Events that led to an infusion interruption, 1% and 1%. So sometimes people did kind of start to do not so good, 1% of people, but 1% of people, and so they had to stop, interrupt the infusion. But no deaths. We'll look at more at some of those details. She said, basically, they're talking about 70% reduction in hospitalization, about 70% reduction in death, and about 4 days sooner are people's symptoms resolving. So let's just read this here. Both the regen-cov 2, 2,400 milligrams and 1,200 milligrams, but reduced COVID-19 related hospitalization or all-cause death compared to placebo. So 71.3 goes with hospitalization. So 71.3% reduction for hospitalization. And 70.4% reduction going to all-cause death. One thing you should know that the p-value, you'd like this to be a small number possible. The number here basically represents the likelihood that these events occurred by chance. What this says, it's very, very unlikely that these results occurred just by random chance. No, we can be very, very certain about the reliability of these results. Same with this one, both on the hospitalization and on the death. It's very, very good p-values. You want as small a number as possible. You'd like to have something below 0.05. That'd be a 5% chance that this happened by chance, by random chance, but we're way below even 1%. So this is great. This is good. And then here you see median time to resolution of COVID-19 symptoms was 4 days shorter in both the dose arms versus placebo. So basically 10 days of being sick instead of 14 days. And again, great p-value. We should be very confident in these results. Okay, so that's good to know. Now you can jump over here. This is, what is this? combatcovid.hhs.gov, United States government, official site of the United States government. And you can pull some information. EUA Factsheet for providers. That's what we're going to be looking at. It's going to be a little bit more to look at, but we want the details. So we're going to look at that. We'll spend quite a lot of time there. So this is a 53-page document, a fact sheet for healthcare providers, emergency use authorization of regen-cov, casirivimab, and imdevimab. So I'm going to be hitting page 14. So just as a little side point, it looks like if you get the subcutaneous injection, which it looks like you do not want to get if you don't have to, because we'll see later that there's a lot more adverse events with the injection, but they're basically going to stick you 4 times, 4 syringes. Okay? Okay, so on page 14 of 53, and I want to stop here at this warning section. There are limited clinical data available for regen-cov, casirivimab, and imdevimab. Serious and unexpected adverse events may occur that have not been previously reported with regen-cov. Hypersensitivity, including anaphylaxis and infusion-related reactions. It says serious hypersensitivity reactions, including anaphylaxis. This is the closing of your airway, have been observed with administration of regen-cov. casirivimab, and imdevimab. The signs or symptoms of a clinically significant hypersensitivity reaction or anaphylaxis occur, if they do, immediately discontinue administration and initiate appropriate medication and or supportive therapy. Infusion-related reactions occurring during the infusion and up to 24 hours after the infusion have been observed with administration of regen-cov. These reactions may be severe or life-threatening. Signs and symptoms of infusion-related reactions include fever, difficulty breathing, reduced oxygen saturation, chills, fatigue, arrhythmia, so atrial fibrillation, tachycardia, bradycardia, chest pain or discomfort, weakness, altered mental status, nausea, headache, bronchospasm, hypertension, so the first one is low blood pressure, the next one is high blood pressure, angioedema, throat irritation, rash, including urticaria, pruritus, this is, I think, itching of the skin, myalgia, vasovagal reactions, so syncope, presyncope, dizziness, and diaphoresis. Okay. Hypersensitivity reactions occurring more than 24 hours after the infusion have also been reported with the use of regen-cov under the EUA. So again, this is emergency use authorization. We would like to know more than we do, but we know what we know. Now, this is also very important. Clinical worsening after regen-cov administration. Basically, that your COVID-19 could get worse. Clinical worsening of COVID-19 after administration of regen-cov has been reported and may include signs or symptoms of fever, hypoxia, this is like low blood oxygenation, increased respiratory difficulty, arrhythmia, atrial fibrillation, tachycardia, bradycardia, fatigue, altered mental status. Some of these events required hospitalization. It is not known if these events were related to regen-cov use or they were due to the progression of COVID-19. And then they talk about some of the limitations. Okay? Jump over to page 33 of 55, and we'll look at the overall safety summary. Approximately 13,500 subjects received intravenous infusions and 2,500 subjects received subcutaneous injections. And this is where we're going to see the safety profiles and why you really would want to get the infusion if you can. Usually that's what they're always going to try to give you because of these adverse events. So it says the safety of regen-cov is based on the analysis of 3 different studies. So COV 267. This is, what is this? It's the phase 1-2-3 trial of ambulatory, meaning non-hospitalized subjects who tested positive, okay? This is the one that we're really going to be looking at. This is, I'm sick with COVID. I want a treatment. This is the 2067. They do another one, 2069. It's a phase 3 post-exposure prophylaxis for prevention, exactly like it says. I was around somebody, I don't want to get COVID, can you give me this treatment so that I don't get sick at all? Okay, that's the 2069. And then this last one is pretty strange. I don't know. I don't think most of us are going to be wanting to do this, but it's the 2093. It's a phase 1, so this is very early on. Phase 1 trial evaluating the safety and pharmacokinetics of regen-cov. Repeat subcutaneous dosing every 4 weeks for 24 weeks. So you're going to get these injections every 4 weeks for 24 weeks. So this is the main one we want to be looking at, and we'll also look at the 2069 just as a comparison so you can see the difference in adverse events between if you get it through the IV versus if you get the shot, the injection, the subcutaneous injection. So let's look at this. The 2067, it's a randomized, double-blind, placebo-controlled clinical trial in subjects with mild to moderate COVID who had a sample collected for the first positive SARS-CoV-2 viral infection determination within 3 days prior to the start of the infusion. Okay, cool. In phase 3 portion of the trial, subjects were treated with a single intravenous infusion of 600 milligrams and 600 milligrams. So there's about 827 people that did that. And they're also still kind of looking at these higher doses, which they've gotten rid of, but 1,200 milligrams. And then they also even did 4,000 milligrams that they were looking at, and then they had a placebo group. So basically it says regen-cov is not authorized at the 4,000 milligram level. Also, the 1,200 milligram level is no longer authorized under this EUA. So you're not going to be getting any of those. You're going to be getting the 600 milligram, okay? Just so you know. Okay, so then what they basically did is they pulled all the data from all three of those groups, the high dose group, the medium dose group, and the low dose group. And it says they looked for infusion-related reactions, okay? Adverse events assessed as causally related by the investigator. They were looking for grade 2 or higher sensitivity, was observed in 0.2%. So that means that's great. Only 0.2, this is grade 2 or higher, okay? So this is a very low number. And what else do we have? It says 3 subjects receiving the 8,000 milligrams, so this is the high dose, and 1 subject receiving the, well, this is really, really, really high dose, 8,000, and receiving the 1,200 milligram dose. So 3 of these people had some of these conditions, which resulted in permanent discontinuation of the infusion. That was 3. How many was in that group? They're talking about the 4,000. The 4,000 would be 8,000 together. So that was 3 out of 1,000 people, 1,012 people. Okay. No problem. And then anaphylactic reactions have been reported in clinical programs in subjects receiving regen-cov. This event began with 1 hour of the completion of the infusion, and in at least one case. That could be 10 cases. I mean, I don't like how they worded that. In at least one case, required treatment, including epinephrine. The events were resolved. So epinephrine is a steroid. The events were resolved. So, okay. So apparently no one died. So we just really have this, a couple events, but we're talking, 3 out of 1,000. And this was 1 out of the, how many people were in this group? 1,200? 1,849. So 1 person out of 1,849 had a problem in this 1,200 milligram group. Okay, so not bad for those numbers compared to this. The 069. This is for the post-exposure prophylaxis, but they were doing it subcutaneously. Okay, this means the shot in your shoulder or whatever. Look at these numbers. They're a lot worse. Adverse events were reported in 265 subjects. That's 20% of people who got the treatment group and 29% in the placebo. So I don't know what's going on with the placebo group. What are they putting in these shots that 29% of people who aren't even receiving the treatment are having some kind of adverse events? I guess injection site reactions are all grade 1 and 2. So this is the important thing to know. How severe were these? They're all 1 and 2 levels, occurred in 55 subjects. So that's 4% of the treatment group, 2% of the placebo group. Most common signs and symptoms of injection site reaction occurred in at least 1% of the subjects in the regen-cov 2 were, so this is like, what was this? Itching. It was like itching and redness. Discoloration. This is discoloration. And this is itching. Okay, hypersensitivity reactions occurred in 0.2%. in the regen-cov group, and all hypersensitivity reactions were grade 1 in severity, and there were no cases of anaphylaxis. So that's actually really, 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 I think, good. Nobody, couldn't breathe. No one had their airway close up on them. And then these were all like low grade, a little discoloration, a little bruising under the skin. Yeah, so this pruritus is itching. But then if you go on, subjects who were SARS-CoV-2 positive at baseline were enrolled in cohort B, received a single dose of the 600 and the 600 milligrams. Adverse events were reported in 34% of the treatment group and 48% of the placebo group. Injection site reactions, all were grade 1 or 2, occurred in 4% of the treatment group, 1% in placebo group. As a side note, I do find it strange that when they're talking about more than 34% of people had an adverse event, and then they only tell us about something that happened 4% of the time. They should tell us about the other 30% of those events. Aren't those important? Yes, of course they are. Most common signs and symptoms of injection site reactions occurred in at least 1% of subjects in the treatment group. These were, I think this is the discoloration and the bruising. This is a discoloration. This is a superficial reddening. and there's no cases of hypersensitivity reaction or anaphylaxis. So even though you had like these pretty high numbers of adverse events, based on what they tell us, there was no there's not really a lot of serious stuff happening. These were low grade events, and this is like you just received a shot in your arm, so it's a little red, it's a little discolored, maybe it itches. But here this is interesting half-life. So how many days for it to have? 31 days it'll have. So they don't give us this information on the other one, but basically, how long until something is basically gone. If you start with 100 times about 0.5, then you got 50 after 28. After 31 days? So that's the first half. Then obviously you go to 25 for the next 31 days. Then maybe 12.5 after that. 6.25, 3.1, 1.5. So maybe be in your body more than 6 months maybe out. It'd be less than finally whatever these units they're using, milligrams per liter. But if you get lost in some of the weeds on this, there are a couple of nice videos like we talked about. So this is monoclonal antibodies, what you need to know. This is from September 10th, 2021. Christy Risinger, MD. She looks a little bit at a journal article that came out in the New England Journal of Medicine. She also sorts through a little bit of this stuff. She talks about her reactions and what she likes and what she doesn't through this. Now this is probably my favorite one though. I gotta say, out of the list, I would recommend definitely watching this. It just explains to you like what are B cells, how does the immune system work, how does it produce antibodies. Talks about what are antigens. It talks about how monoclonal antibody therapies even work. And so this is from Whiteboard Doctor, and it's really great. I would definitely recommend it. He just does some little drawings and helps us understand how everything works, like I said. Now this is a nice one, Dr. Breen. And what he basically does is cover this article here. Studies in human mice and convalescent humans yield SARS-CoV-2 antibody cocktail. So he basically talks about, how did they develop this, basically the process that they went through. They used, like it says here, humanized mice, meaning they've genetically engineered mice to have human immune systems. And then they also take some of the plasma from people that have had COVID before, naturally produce some of the antibodies. What they did is they got a whole bunch of these different antibodies and they basically sorted them out. They basically went through and said, these ones don't work, these ones do work, okay, and then they wanted to find two that work together, so two that don't fight each other. And they talk a little bit about this. This is the receptor binding domain, the RBD, so you're going to hear a lot about this if you watch these videos. So this is highly technical, which is why it's nice to have him kind of go through, like, what the heck is all this, right? All these different versions of Regeneron treatment, and which ones worked and which one didn't, and what this. And thanks so much for checking out the video. Learn a little bit about what's available out there. You can share it with family and friends, and just something to refer back to in case hopefully God forbid, but in case you need it. It's good to have everything set up, and if you need it, then you can go right out and get it done. Remember, you only have 3 days after you test positive before you go in and get this, according to this EUA. So you can't really be wasting any time messing around. So okay, well, I hope that helps, and we'll talk to you on the next one.